According to the Anxiety and Depression Association of America, around 12 million Americans live with post-traumatic stress disorder or PTSD. The National Center for PTSD has emphasized that approximately 6% of Americans will experience PTSD at some point during their lifetime. Additionally, they have highlighted that women are twice as likely to develop PTSD compared to men. PTSD is a condition that occurs after an individual experiences a traumatic event firsthand. These events can include situations like military operations, natural disasters, car accidents, or being a victim of sexual assault. However, PTSD can also be triggered by indirect exposure to trauma, such as being informed about the sudden or expected death of a close friend or family member. Witnessing or becoming aware of harm inflicted upon others can also lead to PTSD. First responders, such as police officers, emergency medical services personnel, and firefighters, repeatedly exposed to severely injured people in extremely traumatic situations, are more likely to develop PTSD. Feeling scared or anxious in response to a traumatic situation is a normal reaction of the mind. However, for individuals with PTSD, these feelings of stress become persistent, and the recovery process takes longer. Symptoms of PTSD can begin within 3 months of the traumatic event or even later. These symptoms must significantly impair the person's daily activities, such as their performance at school, work, or relationships. Additionally, these symptoms should not be attributed to substance use, medication, or other medical conditions in order to be diagnosed as PTSD. Here are some signs and symptoms outlined by the American Psychiatric Association that should be present for more than a month in individuals aged 6 and older to suggest the presence of PTSD. 1. Recurrent and involuntary thoughts of the traumatic event. Individuals with PTSD often experience intrusive thoughts or memories related to the traumatic event. These thoughts may occur unexpectedly and can be distressing. 2. Dreaming of the traumatic event repeatedly. Nightmares about the traumatic event are a common symptom of PTSD. These dreams can be vivid. 3. Flashbacks of the traumatic event. PTSD can cause individuals to relive the traumatic event as if it were happening again. This can be accompanied by intense emotions and physical sensations associated with the original trauma. 4. The individual avoids dwelling on distressing thoughts and suppressing related emotions tied to the traumatic event. 5. Avoidance of anything that refreshes memories of the traumatic event. Individuals with PTSD may go to great lengths to avoid anything that could remind them of the traumatic event. This can include avoiding certain places, objects, people, or activities that may trigger distressing memories. 6. Unreliable memory about the traumatic event's essential details. Some individuals with PTSD may have difficulty recalling specific details. This memory impairment is not associated with brain injury or substance use. 7. Difficulty understanding the causes or outcomes of the traumatic event. People with PTSD may struggle to understand why the traumatic event occurred or how it has affected their lives. They may blame themselves or others for the event. 8. Persistent negative emotions. Individuals with PTSD often experience a range of negative emotions, including fear, unease, anger, shame, or guilt. These emotions may be intense and persistent. 9. Loss of interest in social functions or activities. People with PTSD may lose interest in activities they once enjoyed and withdraw from social interactions. They may isolate themselves and avoid socializing with others. 10. Social detachment. Individuals with PTSD may find it challenging to connect with others emotionally. They may feel disconnected from friends, family, or their community. 11. Absence of positive emotions. A common symptom of PTSD is the inability to experience positive emotions such as joy, excitement, or fulfillment. Individuals may feel emotionally numb or detached from positive experiences. 12. Increased irritability and sensitivity. Individuals with PTSD may become easily agitated, irritable, or angry. They may have a heightened sensitivity or aggressiveness to people or other stimuli. 13. Neglect of self-care and engagement in risky activities. Some individuals with PTSD may neglect their personal hygiene, health, or well-being. They may engage in reckless behaviors or take unnecessary risks. 14. Heightened alertness. People with PTSD often exhibit increased vigilance and hypervigilance. They may be easily startled and constantly scan their environment for potential threats. 15. Challenges with concentration. PTSD can impair an individual's ability to concentrate and focus on tasks. They may have difficulty completing work or school assignments and struggle with memory recall. And 16. Sleep disturbances. Many individuals with PTSD experience difficulties falling asleep or staying asleep due to traumatic event memories. Should an individual suspect they may be experiencing PTSD, a PTSD self-screening test is available through the National Center for PTSD at ptsd.va.gov/screen/. Nevertheless, it is essential to acknowledge that only qualified healthcare professionals possess the expertise to provide an accurate PTSD diagnosis and administer personalized treatments for this condition and other mental health disorders. If you found this content informative, kindly show your appreciation by liking this material and subscribing to our channel. We value your support.